The recording going? No transcript. Awesome. Thank you all for joining us this afternoon and taking a little time to attend the STARS coordinators meeting. Gonna run through our usual welcome. I got some kudos. I'm gonna discuss the new advanced directive for my Missouri practitioners. Then we'll run through some of our usual metrics and some education opportunities that are coming up. Wanted to just give a couple kudos out there. This one for Lincoln County 911, just noteworthy. They and Lincoln County reached out to us and just gotten STARS kind of reestablished in their dispatch center, just in time to within a couple days catch their first STARS dispatch calls. So just kind of good to see the whole system come together just in time for one of those kiddos up there. So that was cool. And then wanted to give a shout out to Stoddard County 911. They're just have always been very proactive, including paying attention to when Stoddard County crews are responding for mutual aid outside of their county. Particularly, we have a special needs home in the county south of them now, where a number of our STARS patients have ended up. And so they are always just being very diligent about knowing when they're running STARS and getting kids from other agencies added into their list as well. So just wanted to give them a positive shout out. Did want to briefly touch on the TPOP polls forum that just rolled out in Missouri. This for my Illinois providers, you already have the Pulse form, and you know how it works. It is an advanced directive. It works the same for kids as it does for adults. This we have not previously had this form available to us here on the Missouri side of the river. It was just implemented starting December 30th. I should say the form existed before then, but it was never practically used because the old legislation did not provide indemnity to EMS providers if they were to run one of those calls. That has since been fixed as of 12/30/24. So an EMS provider is now protected if they are honoring a Pulse form. There's going to be a fair amount of education rolled out regarding this, hopefully from the adult side as well. But I know Dr. Finney over at Children's is working on putting one together for pediatric specific that I think we're going to help with in the next couple weeks. So hopefully we'll get all of that information out to you guys. Just to try and clear up what is otherwise kind of a thorny topic sometimes. The Missouri Purple form still applies. If you run into one of those, that is still a legit working document. But what you'll now see in addition is the possibility of a TPOP or a pulsed form. It's actually a much better form because it's way more detailed than the out of hospital DNR. And so I think what you'll hopefully see is just a movement towards standardizing all into one form so that we don't have confusion about multiple forms in this space. But that will require just the children's hospitals to all kind of be on board with moving to the same document. So there's some work being done towards all of that. This is very fortunately not a huge issue. There aren't a ton of patients. Of course, it's very important to the patients and the families who are dealing with this. But I did poll just for Missouri STARS kids that are currently affected by this change. You can see that we have current 7 kiddos currently in Missouri with an active DNR form. So. I did want to just call attention to some other things that you'll find in the STARS forms that tend to accompany with these kiddos. Obviously, there's the component of addressing the out of hospital DNR and whether we should be doing chest compressions or not for these kids or rendering resuscitative measures. We will just match the language in the STARS document to whatever the family has in the advanced directive for those kinds of issues. Some other things that we do try to provide in those forms to you, if we know it, if there's a hospice agency involved, we'll try to have the number in there so that you if you're on scene, you have an out or an avenue to call, if it's especially if it's more like a subacute event. And then the last thing that I really wanted to draw attention to, but some of our patients who are home with DNR, particularly some of our oncology patients, are in significant amounts of pain and they have pretty extensive pain regimens. And just something we've seen for that patient population is really being cautious on overdosing them with Narcan. This is not your standard street corner overdose of somebody who's in the throes of a heroin addiction. This is a patient who we very much want to remove the pain that they're having. And so if we are, if they have overdosed, quote unquote, to an extent, they're to the point of respiratory depression, all of the clinical goals are at just returning adequate respirations and ventilation, but not a full-blown reversal of the opioid effects. There have been some really significant and bad outcomes of patients on long-term pain medication therapy being just given the full 2 milligrams of Narcan, and they'll come out of it quickly and they will start seizing, and all kinds of other awful things start happening. So that's not the goal with these patients. They're just they're a different patient population, and there are just some instructions for those specific kiddos that you will see in their forms. So those are just some of the notes you'll see from us regarding them. There, like I said, hopefully a lot more to come on the information and the training for this. But I did want to just give a moment if anybody had any specific questions that come to mind for them right now.
I got one question. Is it like an adult DNR where the treatments can be curtailed, or with kids is it just pretty much all or nothing, or no intubation, cardiac drugs, no IV, but you can do chest compressions type situation?
Yeah, so the new form is going to give you a lot more nuance to the treatment. So there will be, this family wants everything done except for electrical shocks. Or maybe this family over here wants, just chest compressions and a trait change, and if no return of, a spontaneous heart rhythm, they're okay. So there will be a lot more detail with regards to the limited resuscitation that they want. It also kind of allows, so the top of the form will be basically the old purple form, a go, no go style situation for you have a pulse respirations. Do you want us to go to work or not? But the middle section is also handles just critically sick patients. It says like, hey, if they're really sick, but they still have a pulse, what do you want to have happen? And is it full blown, antibiotics and innovation and put on a ventilator? Or is it more like, no, we just want supportive care measures and fluid resuscitation and pain management? So you'll see, I think, a lot more detail through those forms on those kind of topics.
Got it. So, cool.
Yeah, good question. Thank you, Mr. Matt. Were there any other questions regarding the new document? All right. Just this is a kind of an awareness topic, but the DME and equipment operators within hospitals and out there in the community go through changes, and one of those changes is we are seeing all of the home ventilators become the home ventilators. At least throughout Glennon here, way far away from here, we have some patients going further away, a couple hours away rurally, who might be on like an Astral ventilator. But this is really what we're seeing a transition to here within the hospital over the next couple of months. And so I just wanted to bring up some awareness that if you've seen previous trainings from us or videos, or we've been out to your locations, all the ventilators are going to start to look like this. Overall, I think it's a plus. Like it's the Voxen ventilator for any of your agencies who've encountered kids with those before. So Voxen just stands for it's a ventilator, but it actually has a built-in oxygen concentrator. So within the actual device itself, you can start giving the kiddo some more oxygen. It's got cough assist built in. It's actually got inline suctioning built in, and it's a nebulizer too. So that's a pretty fantastic device. It's sort of like looking at the future whenever you see it. So it's cool. We'll still put some of the same settings on there for the kids who have it. But I just wanted some awareness about that. And then the next meeting, our March meeting, the V-Home vent rep is going to come and give us just a few minutes of introduction to it. What does EMS need to know about it? And then I think we're kind of in agreement from there. We need to probably proceed and have a better training for what EMS can do in the home with this device, and then transportation with this device. So just kind of want to put that out there at an awareness level, but there will be more to follow in this for sure. All right, and that brings us to the numbers. We're up to, I think, 1,612 kids as of this morning. And that is a net gain of 23 new patients since we met last month. Continue to see pretty good system login and usage. So thank you, especially to the dispatch agencies that are logging in every day. Did see a total of 47 dispatches for last month. So pretty good numbers there. And had a good number of emergency activations as well for last month, albeit February is on pace to far outstrip that already. As far as stars views by region so far for 2025, you can see there we had a lot of people getting in for training. That's awesome. We always highly support that. So if you're getting in to look through kids in your area or potential mutual aid kids and you're just trying to learn about them, thank you for logging in and doing that. A lot of care plan review, and then we had a decent number, 162 views for emergency treatment. So had 42 911 transport calls for the month of January and 4 non-transports. Respiratory distress on 3 out of those 4. And then we saw about 55% of the calls had the STARS info referenced in the EMS trip sheet. So STARS coordinators, if you don't mind, just if you could find a way to have that auto magically documented, that would be awesome. But if not, if you don't mind, just reminding your crews to put that info in there. And 73% went direct to tertiary. And there's your reasons for the 42 calls. So respiratory distress, seizure, and fever, and then a few sick cases. So I don't have to tell you guys, it is the season right now in pediatrics. Everybody is sick. Everybody. All right. Some of those new measures that we're tracking for this year. So this is just for the month of January this year so far, but we're looking at how your crews document managing the airway. I do count patient positioning. That's a big thing in peds, especially special needs peds. So making sure you got that patient in a good position where they can take adequate ventilations. And then we had 4 cases of trach management and 1 of intubation. And then you can see the different methods by which oxygen was given in the trip sheets where that was documented. And so the other thing to know, let's see, we are also just tracking medications. Seeing a fair number of steroids given, Versed for seizures, and then the multiple EMS medications was for an RSI for that intubation. All right. I did see a drop in number of days for MD care plan approval. So thanks to your docs who were getting in and approving these a little bit faster. I'm sure many of you have noticed you are CC'd in all the emails going to your docs too. So if you're at an agency, if you got good communication with them, just it is okay to check in with them, start asking questions. We will take feedback if you need to defer the plan back to us because something in there doesn't jive with your local protocols or capabilities. So please just give us that feedback if you encounter something in one of those emails for a plan coming through. Do have some education opportunities coming up. This slide is now a lie as of today. So we were going to be out teaching at Cape Tech tomorrow. It's been canceled for weather, but it will be on March 7th now. So for anybody Southeast Missouri or Southwest Illinois who wants to come see us, we are going to do a day of pediatric education. It's free. There's Missouri CEs offered. So anybody who'd like to come see us March 7th at 1080 South Silver Springs, please come do that. I'll hang here for a minute for anybody who wants to scan the QR code. But our EMSC office here in Missouri is organizing a couple of education days with the children's hospitals. And so there will be a couple Missouri dates coming up and actually one also in, I believe, O'Fallon, Shiloh area over in Illinois later this year. So for all the providers who, if you want to come see a bunch of the peds educators, we'll be out giving a full day training for that as well. So happy, or hopefully we'll get to see many of you there. I did want to put just a brief reminder out there. We have the trach and G-tube training kits with the training binders. Those are available for checkout now. So if your agency wants to borrow one for a week or 2 weeks, so you can run around and see all your different crew members. There's some basic binders with information in there. We tried to keep the questions really pretty limited as far as we just need to know how many people you taught, but not a ton of details about each of those people. So if you want to do just a real simple roster for us, but that way we can just tell the grant who gave us all of the kits how they were used. And so would love to get those out into the world. I think we have one currently checked out. That means there's 5 more that would love to be in your agencies being used. The last additional QR code. Sorry to join the modern day world, but I'm gonna use QR codes to solve a few things. I did just want to give a shout out to our adult EMS colleagues here at SSM. They've been helping supporting and put out a training there for pre-hospital mental wellness and health. I attended the first one. It was really good. That's free, and they have one more session coming up next Monday, but I think it's a class they anticipate offering a few more times throughout the year. So if anybody's interested in next Monday, that's the QR code that'll allow you to go sign up there, or at least find out some more info about the course. This is a better QR code because it's got a dinosaur in it. And I'm a child. So here's a link to the education request page for the Cardinal Glennon outreach team. So if not just even stars, like if you need trauma training or airway review or anything like that, there you have the ability to go on there and request some education. So please feel free to use that. Only and especially for my dispatchers on board, I'm sure you're all very aware of all the emails and the change in the dispatching platform. I really hope that's working well. As far as we can see from our side, it appears to be working very well, but please don't hesitate if something doesn't work right for one of your dispatchers to reach out to us so we can get it fixed. As far as upcoming website changes that will impact end users for stars, there's nothing coming up imminently on the docket. A little bit later this spring, we're going to work on just even further improvement of the notifications and emails that you get. One of the current challenges in the program is, say a kid lives in St. Charles County and they already know about them, but the family moves and they move over to, we'll say, Sparta in Illinois. So they go down to MedStars district. We move them within the system on our side, but that doesn't automatically notify everybody else. And so sometimes there's confusion for St. Charles where they're like, hey, what happened to our Star 1000? And then Sparta runs a kid that they didn't know about. And they're like, who in the world is this Star 1000? We're going to set it up so that it just notifies everybody whenever the STARS teams at the hospitals are moving patients around. And you'll get the reason why they're being moved in there as well. So just kind of meant to enhance the communication happening with the day-to-day work being done here. That is the majority of what we had. One other thing I meant to mention back around the TPOP Pulse part, but a discussion that came up recently here in the office with my partner Beth here is just how the STARS teams can be used for critical stress debriefing calls. We know that Pete's calls are kind of hard on our crew members, and some of the STARS kids are just the most prone to having critical calls that our crew members will run. So I certainly don't think we're a replacement for a peers or a PSRS or any kind of critical stress debriefing that you were going to do, but we can participate in those or provide information or background on the kids. I've done that a couple of times over the years, and just to know that we're meant to be a resource to help you guys through, hopefully, getting better outcomes on calls, but also, getting your crew members through challenging calls that they go through, and just some of our STARS kids are challenges. They're tough calls. So I just want to make sure that, you as coordinators are aware that we can be here as a resource for that as well. So that was everything I had prepared for today. Were there any questions or concerns about anything that I went through?
All good here.
Awesome. Thank you,
As for the flyers to be attached to, or the education, I said I can send them out in the email.
Perfect. Awesome. Oh, and Mr. Matt, I can touch base with you more outside of this meeting, but we had one of your schools reached out and asked for training for one of the kids. So I think we're gonna coordinate with Children's, and then we'll invite you guys once we get a date and see if we can get your crews over there too.
Awesome. New kid or?
No, actually, a kiddo you've had for a while, but I think some recent clinical changes and the school's a little concerned. So
got it. Okay.
I'll stop the recording in case that's what's stopping people from talking to me.